this is Dr. Do again. This video is the systemic approach of medicine. Have talked about the invisible components from the four major organic compounds, their metabolism and diseases, typical diseases actually, and move on to the cells and briefly introduce about the cell component and some diseases associated with the cells. For example, the cancer, because of the apoptosis. Not under regulation, so develop those abnormal cells into malignancy form. And also today going to move on to the visible component, which are the tissues. The tissues really is it's like the building up from the blocks of the cells, and then also different kind of tissues form the organs. So that's the systemic approach, how to organize this view of medicine from the fundamental. So the tissues we actually in the body is not like the organs, we have so many variety, but the tissues only have four, actually just four form of them, but one of them containing the variety type. So the four major tissues are muscular, in the heart, in the skeletal muscle, and also the nervous tissues form the nervous system, and also the connective tissues, which is the one who have variety forms. The connective tissues including the bones, the bone tissue, and also the fibers, the adipose, the fat, and also the cartilage. Those are all variety, and these are just limited few. Actually, I'm going to talk more when I talk about diseases, individual, what the tissues involved in diseases. And the last one actually is also variety. It's the epithelial tissues. It's lining on the surface on the skin, and also the digestive system, the oral cavity, and also the digestive system, respiratory system, and blood vessels, just with different name. For example, the blood vessels lining on top of the blood vessels not called epithelial, but they are the endothelial cells. It belongs to the epithelial tissue. So these are the major four type of tissues. And the diseases associated with the individual tissue, I just give you some example. So these are the visible because they are real. They are different kind of tissues mingled together in the organ to carry on the function, specific, multiple, variety as organism in our body. So this is how to put it. Typical diseases, for example, epithelial tissue. The diseases occurring in epithelial tissue, the most common one, abrasion or ulceration, just either the skin or the internal organs. For example, the abrasion of the epithelial tissue in the digestive system causes the gastritis, inflammation, and if it goes deeper, then the gastric peptic ulcers, like the gastric ulcer or the small intestine duodenum ulcer. So this is the very common, simple form of the disease associated with this epithelial tissue. On top of that, of course, the cancer of the skin, and through the epithelial cell, the cancer, the variety, adenomas, and any kind of other type of cells are derived from this epithelial tissue. And so for the disease, for the other kind of the muscular disease, from myositis to the necrotic of the muscular cells, for example, the myocardial infarction that's occurring to the muscle tissue, belong to the cardiac muscle, and undergoing the ischemic inflammation necrotic process. That's the infarction really occurring in this cardiac muscular tissue. Of course, associated with this cardiac muscular tissue infarction, other tissues like epithelial tissue, the blood vessels, the endothelial cells undergoing inflammation, and the plaque formation. So this is how to in the beyond the gross you all see it, or the medical term, and there's a deeper to integrate, or deeper to the tissue level, what happened to the individual disease, and also the diseases occurring to individual tissue. And also for the connective tissue disease, that's probably one of the most complicated diseases, the tissue with a variety of diseases, because the connective tissue really had so many inclusions. Like I said, first of all, blood. Blood is a connective tissue, just in liquid form. So the disease also associated with the blood, from fundamental, very well known anemia, different kind of anemia, to the malignancy in the blood, and so the connective tissue, like blood, for example, there's a component of solid component, which are the cells, and also insoluble, actually the ground substance is the plasma. So this is about the connective. Other examples of the connective tissue disease, the joint disease, actually just the fibers, they're all variety of arthritis. You can name them. They all belong to the connective tissue disease. And also there's some genetic caused connective tissue disease, either the Marfan's, you probably heard of it. Marfan's disease is the fibers, the cartilage, or the different kind of collagens not very well developed, or the cartilage or the bones not very well developed. Those people, and a variety of the other examples of these connective tissues, like the bone diseases. So this is about the and also the lipoma, for example, another example of the connective tissue disease. So this is, and there's a group of disease called connective tissue diseases. If you search, you can find a variety of them. And also the autoimmune disease, they attack those connective tissue, the fibrous tissue, the fibroblast cells, and also the membranous structures. These are all the connective tissues. So this is one of the other tissue. Of course, the nervous tissue, the neurological diseases occurring in this, the inflammation or the neuritis, for example, the optic neuritis, it's just the idiopathic majority of cases. You do not know the causes, sometimes autoimmune, but sometimes just idiopathic. After the upper respiratory tract infection, you develop eye pain, particularly in, it doesn't have to be in specific age, either from young or old, can have those neuritis. It's very, and also different kind of neuropathies. Diabetic, for example, impaired peripheral nerve fibers cause this diabetic peripheral neuropathy. So this is just at a different level, but these are the visible, regardless what you think about. I talk about the invisible compounds, the cells, but at the tissue level, it's visible. We can see it, and also the body, the organs, the organisms are the mix of those four type of tissues together, with the parenchymal cells, which, for example, the hepatocytes, as the parenchymal cells surrounded by those connective tissues or the other tissues, and carry on the functions. So this is about the fundamental, another level of fundamental basic knowledge, and integrate in the clinical diseases. And I hope it triggers your interest and also give you some idea. So I'm going to stop here, and thank you for watching. I'll see you next time.